I'm Sassy Mouse, and today we're going to talk about the different categories that drugs can be categorized into. Drugs can be categorized into many different categories depending on a number of factors. Many categories have subcategories, which can have subcategories, which can have subcategories still. Today we're going to talk about some of the major categories that most drugs fit into. These categories are based on the effects of these drugs and how they interact with your body. The first category we're going to talk about today is stimulants. Stimulants are called stimulants because they stimulate the central nervous system. The central nervous system is the system of nerves that control your heart, your lungs, and your brain. The main effect of a central nervous system stimulant is an increase in energy. This increase in energy can also cause a decreased need for sleep or decreased fatigue. It can also increase your focus or concentration. These effects can be particularly helpful for certain medical conditions, and if you are using them regularly, it might be worth talking to your doctor to make sure you're not self-medicating for an underlying condition. Stimulants also cause a decreased appetite. This decreased appetite and subsequent weight loss can make quitting central nervous system stimulants much more difficult. An important side effect to a central nervous system stimulant is that it increases your heart rate. Having an increased heart rate can cause your heart muscle to become more muscled and not function as well. Buff heart is not actually a healthy heart if it doesn't have the other physiology to go along with it. In addition, stimulants can cause an increased risk of stroke. Because of this, it's important to be aware of what doses you're taking and what side effects you're feeling. Some examples of stimulants are meth, cocaine, Adderall, and caffeine. The next category we're going to talk about today is depressants. Depressants are called depressants because they are central nervous system depressants. The main effect that people are going for with a depressant is that they're generally relaxing. This relaxing effect can cause you to feel more drowsy or more chill, or like you're just sort of in a more dreamlike, relaxed state. Depressants can also make it more difficult to focus or concentrate. One of the main risk factors for depressants is that they depress your heart and your lungs. This is especially risky if you combine multiple depressants together, as they can cause you to stop breathing or cause your heart to stop. This makes it really important that you know how to deal with an overdose on these drugs, as they are some of the more fatal overdoses to deal with. Depending on which depressant it is, they can also have some very risky withdrawals, although not all depressants are dangerous per se to withdraw from. Some examples of depressants are heroin, alcohol, and benzos. The next categories we're going to talk about are sometimes lumped together as hallucinogens, although may be better described as just an other category. The first subcategory in this other category is psychedelics, or what are called traditional psychedelics. The word psychedelic means mind manifesting, so these drugs manifest things inside of your mind. The main effect of a psychedelic is they cause visual, tactile, or audio hallucinations. This means that you may see, feel, or hear things that are not really there. However, with traditional psychedelics, you are generally aware that these are hallucinations, at least at common doses. Another common effect of psychedelics is that people have an increase in self-perceived insight, feeling that they understand a problem better or have a greater insight into the world as a whole. Although this insight can be great for creativity or problem solving, be aware that not all insights on these drugs are always accurate. Another common effect of psychedelics is that they cause changes in your mood, making you more susceptible to high or low mood effects. This change in mood, as well as some of the other effects, make it really important to be aware of your set and setting before taking these drugs. As a reminder, set and setting is being aware of your mindset and the setting in which you are taking drugs. This allows you to reduce the chance of a difficult, or as some people call it, bad trip. As I said in my Drugs 101 video, no trip has to be a bad trip. If you view it more as a difficult trip, it views it more as a challenge than as something that is just bad that's happening to you. Although a minor side effect, another effect from psychedelics is that they can cause reduced appetite or vomiting, sometimes because of changes in taste, but oftentimes just because they're affecting how your digestion happens. The biggest risk factor with a psychedelic is, of course, the change in mindset. So if you take very good care to be aware of your set and setting, you will generally have a neutral to positive experience, although you can still have difficult experiences even being aware of that. If you're taking a psychedelic, having a trip sitter can be really helpful. Some examples of psychedelics are LSD and mushrooms. The next category we're going to talk about is deliriants. Deliriants are called deliriants because they cause a state of delirium. You may not know what delirium is, but we'll talk about some of the major effects here, and that might help you out. The main difference between a deliriant and a psychedelic is that deliriants cause hallucinations that you may believe are actually real. Whereas with psychedelics, you are generally aware that the things you're seeing are not true, at least at common doses. A common dose of a deliriant may cause you to see, hear, or feel things that you believe are actually happening. In addition, deliriants can cause significant confusion. They also can cause ataxia or difficulty with body motions, which can lead to clumsiness or hurting yourself if you get up and move around, particularly if you're seeing things that are not really there. Deliriants also have the possibility of causing dysphoria, which is essentially the opposite of euphoria. Dysphoria is a feeling that something bad is happening or something is just sort of wrong. The most important thing with deliriants, as with psychedelics, is being aware of set and setting. However, this is even more important with deliriants because these effects can have an even bigger impact on your mental and physical safety. It is also important to be aware that some deliriants can also cause very dangerous physical effects on the body, so it is very important to do your research before taking one of these drugs. An example of a deliriant is datura. The next category we're going to talk about is dissociatives. Dissociatives are called dissociatives because they cause you to dissociate from your body or your mind. The major effect of dissociatives is that they cause a separation between you and yourself. A good rule of thumb is that psychedelics cause you to look in, whereas dissociatives cause you to look out. Dissociatives can commonly cause out-of-body experiences or feelings that you are floating or separated from your physical body. Dissociatives also commonly cause visual, audio, and tactile hallucinations, but they may also cause hallucinations of proprioception. Proprioception is another sense that your body has that basically tells it where it is in space. When your proprioception is messed up by dissociatives, a common effect is for you to feel that gravity has changed or shifted or is pulling you in a different direction. This can cause you to feel like you are falling backwards even if you are laying down in a bed. Another common effect of dissociatives is a numbing of the body. This is why some dissociatives are used in surgery. Dissociatives also require an important awareness of set and setting. However, because of the separation from the body, the setting part of that is especially important because although most dissociatives cause you to not want to move around, some of them do, and you can definitely hurt yourself if you are having an out-of-body experience while walking around in a dangerous room or around town. Some examples of dissociatives are ketamine, PCP, or MXE. Another category of drugs is empathogens. Empathogens are called empathogens because they generate empathy. Empathy is the feeling of connection or feeling of other people's feelings. Empathogens can make you feel more connected to another person or like you understand their point of view better than you normally would. Often this causes euphoria, feelings of closeness, increased feelings of love or compassion towards another person. Empathogens often also have the effect of being entactogens. An entactogen makes it feel good to feel. Empathogens can cause some physiological effects, so it's important to research them beforehand in case there are certain risk factors that you need to be aware of. The main risk with empathogens is that they lower your inhibitions and may make you feel closer to and more willing to do things with other people that you normally wouldn't do. However, empathogens also have the potential to be very helpful in therapeutic situations and may be used for this in the near future. Some examples of empathogens are MDMA, also known as ecstasy or Molly, and MDA. Remember that drugs may not fit into one of these categories perfectly. Some of them may have some effects at some doses and some effects at others. Each drug is categorized based on the typical effects that someone experiences for it at a common dose. You may experience certain effects that are very different from these categories because you have a different biological makeup than another person. Always remember to do your research before taking a drug because you don't know what the effects are until you know, and even when you know, there might be certain things you need to be aware of to help you have a better and more safe time. Remember that the safest choice is always abstinence. However, this may not be the right choice for everyone. Before doing any new drug, do your research. These categories are going to be very helpful in a new series that I'm going to be coming out with in the near future. These videos will be a deep dive into individual drugs that will include which category they're in, their effects, some of their major risk factors, and some of the harm reduction strategies that are important for that specific drug. Keep a lookout for those to start coming out very soon. If you like this video, hit that like button. And if you like this channel, don't forget to categorize that subscribe button and subcategorize that bell. Remember, stay safer, everyone. When dissociatives mess with your proprioception, 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 when dissociatives mess with your proprioception,